Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut.
And what are we
All
talking
things
about, guys?
aesthetics.
What are we talking about today?
So today we are diving into this skin resurfacing treatment, Erbium laser. So
Really, I want to kind of break it down into, we'll talk a little bit about skincare. We'll talk about what lasers are, and we'll talk about why lasers are really important. And we're going to have Crystal, one of our expert estheticians from the Weiler Plastic Surgery Group, coming in, joining us for the second half.
she's fantastic. She's my esthetician. I see her all the time.
She's very good. So
Crystal's amazing.
I always like to, so let's just talk about the skin in general, right?
Yes.
So
Okay.
to me,
The largest organ.
Yeah, I love it.
pretty good.
The
The largest organ, and I think, kudos to dermatologists. It's really an important aspect of your appearance. As surgeons, we can do tons of stuff on the face and change and improve. But if that skin ain't there, if you ain't getting it, you're not looking good, right, Taylor?
I see it all the time with injectables. Everybody wants to have a tiny bit of Botox or a easy fluff facial, and they want to transform their skin. But if you're not involving lasers in your regimen or in your maintenance,
Especially as you get older.
yes, that is a pertinent part of anti-aging of the face.
Right.
Just skincare. I mean, I know we've talked about this before, having everything done, but then you don't do just regular things like
Right.
wash your face
Right.
and stuff like that. So it's extremely important to marry all of it together.
So I'm going to give our viewers and you guys my little
Spiel.
skincare talk. So I don't claim to be a skincare expert. I think I have some fabulous employees that are experts for me. I am I would say a little bit of a laser expert. But so I tell patients, skincare. So all skincare is trying to do the same thing, in my opinion. And what that is think of your skin as two layers, your top layer and your bottom layer. And yes, there's multiple layers, but really your top layer is what you see and your bottom layer is what supports or tightens your skin, okay? When you're young, your top layer tends to be really, really thin and your bottom layer tends to be really, really thick. And what happens, in my simple mind, it sort of reverses. And yes, there's more details, and
So
yes,
it does
this is simple.
this, and then over time it does this, right?
Correct.
Yeah.
Correct. And that's, in my mind, why you get those deeper wrinkles, why your skin loses its collagen and elastin. All these people hawking oral collagen online, right? And so there's
Do you really
skincare.
think that works?
No.
I know. I'm like, it is the craze. Oral collagen. Is it doing
Collagen
anything?
everywhere? It's everywhere.
I think it may help your hair, your joints, but as far as your skin, I'm like, how in the heck is that?
Can I say a medical
Possible.
statement here? So it is extremely difficult to ingest vitamins, much less a collagen through your stomach, through your gut, right? The problem is that, a lot of these pills that we take are specially formulated to be absorbed at different parts of our gut or our stomachs. And collagen, it's like fiber. It just really passes through
Right.
our gut. There may be a microabsorption there, but
Yeah.
it ain't getting to your skin.
Right.
ladies.
But it's everywhere.
Right.
It really
oh,
is.
it is.
It is everywhere.
It is.
And I don't want to burst the bubbles. It doesn't hurt.
Right. That's what I say. I'm like, it's not going to hurt you.
It's not going to
but-
hurt you.
Not gonna hurt.
And there may be a little bit of a, sort of a mental effect. So,
Right.
but it's not going to help. So,
Back on track.
yeah,
Sorry.
back on track.
sorry.
All right. So we got our little skin. So top and bottom. And so really skincare or anything that we're doing for our skin, the goal is to thin out your top layer and thicken your bottom layer. And so let's start with, I call it a pyramid. All right. Like a
Okay.
little pyramid. All right.
Skin pyramid.
All right. So the base of your pyramid is everyday skincare. Right. And so you've got these products, and we've got a lot of products, and they all do a whole host of things. But really, when you start get right above that first layer, you get into more of like a retinol or a retin-A. And it's a little bit more of an aggressive medical grade skincare. And what that's doing, people's complaining because it irritates their skin, right? But what it's doing is it's irritating the top layer to flake and peel and thin out your top layer. And it's trying to thicken your bottom layer. Now it's doing it chemically. It's doing it with little small micro applications every day or every other day. So it takes years for it to work, okay? And so you can go one step above medical grade skincare, which to me is peels, okay? And peels are just, in my little simple mind, more concentrated medical grade skincare, right?
Yeah.
It's like a little bit more of an aggressive, instead of like you're having an esthetician come in who's very knowledgeable, you're preparing your mind. I'm going to have some crazy looking skin.
Yeah.
I'm going to peel like a alligator or something for a couple of days. And so it's
Thinning that top layer.
Yeah, it's thinning
A
the top layer.
snake, maybe?
Yes, a snake.
I don't- there
alligator.
it is.
That's my
All
South
right.
Louisiana coming out of me.
I don't know if
We're having,
alligators
we're
peel.
having a snake problem at the office. I can't. A lot of rain down here in Louisiana, and the girls are walking into the office. They're telling me they're seeing a snake, so I'm going to stay away from the snake thing. But and so it's just accelerating or quickening the process, so you can jump ahead. But you have to have multiple peels to get there. The step above that is what I call light-based or energy-based devices, and or maybe even a physically based device like microneedling.
Okay.
So these are devices that our estheticians, and we'll focus on this all throughout our series, but these are devices that are either mechanically causing some skin disruption, or they're using energy, whether it's electrical energy, ultrasound energy, light-based energy, okay? And sometimes they have some downtime, sometimes they don't, but they're accelerating your skin to improve. And then on top of that, we've got the lasers, right? The ultimate lasers. And lasers,
Which is at the top of the pyramid.
top of your
Yes.
pyramid, right? So you've got your basic skincare, you've got medical grade skincare above that. The little layer above that, like we're building a pyramid cake, is going to be your
Chemical peels.
right? Your little layer above that, it gets smaller and smaller, is going to be your energy-based devices, light-based energy. And then above that is the big one, lasers.
lasers.
right?
Lasers.
And the laser, right? So today we're focusing on that Erbium YAG or Erbium laser, right?
And an Erbium YAG laser, in very basic layman terms, is how would you put that?
I'm going to ask you, Taylor.
Okay.
Okay.
So we feel that I see that it's very necessary because there's a big spectrum of lasers.
So tell me what you think, and I'm going to put you on the spot, and Brittany, in your mind, what's a laser?
Oh.
Does that make sense? Like what like
I'm, of course, like as soon as this is just, I've been living with my husband for too long. Laser, immediately, I'm thinking of Star Wars.
Yep.
Second,
But what do you always notice about a laser when even if you watch it on Star Wars?
Light.
It's light.
But it's a
very
color,
concentrated color. It's a
single
beam.
Yep.
It's
a
a
single.
beam.
So think of a laser as a single concentrated beam / color of light. So in simple terms, they're picking out. So, and I'm going to get a little technical here. Light is a spectrum, right? A wavelength. Okay. And we know that our eyes perceive some visible light, which on the spectrum is roughly between maybe 100 to 800. The spectrum goes all the way up to 32,000. Infrared light, all this light way up there, right? And so we can see, or we see like with lights up to about 800. As you start getting into lasers, so they're picking a single little band. So a single little
Wavelength, right?
Yeah.
right?
Yeah.
That's all that laser is producing, and that is typically seen. You can't see an Erbium YAG laser, to be honest with you. You can't see it. It's not like you're going to.
What do you mean? Like you can't visually see
Correct.
the
Visually
live?
see it.
Right.
It's not like Star Wars where you got this beam. Pew! Now they
Yeah.
do have lasers like that.
Yeah.
But that laser has to be within the beam of visible light.
Right.
So as we get into these more higher end lasers like an Erbium YAG or a CO2, we can't actually see the light, which is weird when you think about it.
Yeah.
You can see the effects of the light.
I was about to say, so
Yeah.
you're following the pattern on the skin rather than visually seeing it
Correct.
enter the skin.
Correct, because
Yeah.
it's not a, pew, pew, pew,
Yeah.
we're not shooting off lasers. They do have those, and that's what people think of. So it's a single band or a single point of light that's focused in a single beam. And that's kind of what when someone says the word laser, I think of.
Yeah. Very specific thing that we're trying to get here.
Right. And it can be like, getting a little Star Wars. It can be red, it can be green, like your lightsaber, right?
It is very confusing to try to understand the wavelengths and what they do differently. So Erbium YAG is a 2940. Then there's 1540s, and there's that is a little too technical probably, but
well, I think the thing to understand is that every laser is a specific wavelength.
Right.
Whether it's 840, 510, 1050, 1040, 1120s, 1540, Erbium YAG is a 2940, CO2 is like a 1060, 10,600 CO2. So there's a lot of them. Now, the beauty of all this is that we've learned that each wavelength does a different thing.
That's what I was about to say. For everybody else, each wavelength does a little something different.
Does a little something different. Now, they're all, so like, I went to my plastic surgeon's office and I got a laser, okay? So almost every laser is trying to improve the tone and texture of your skin, right? Now, they all have that little wrinkles to them. So our lasers for laser hair removal are focusing on hair follicles, and they're like Star Wars, blowing them up, right? So that's a different wavelength. Then somebody comes in and says, hey, I've got a tattoo that I want to get removed, right? And so you look at the tattoo and you go, oh, that tattoo is green or black. I've got this wavelength. Oh my goodness, that that tattoo is red or pink. You got to pick a whole different wavelength for that. And people don't understand that. And then the higher the wavelength, typically the more powerful it gets.
So is that why CO2 is so high?
And when you start getting above a certain amount, and the two lasers that get into what we call ablative territory. And ablative there's two main lasers out there. One of them is the Erbium YAG, which we're talking about. And then the other one is the CO2 laser. Okay. Next question is probably, when you're thinking in your mind, what is the word ablative?
I was about to say.
Brittany's over there thinking,
no, please tell me. Like this is definitely like y'all's area.
Oh, yeah.
Like when it comes down to things. But it is so interesting.
Why would I want more basic than what we're talking? Why would I want Erbium YAG laser?
Yeah, like what am I coming in for asking that you're like Erbium?
Yes.
Yeah, like Erbium's going to be the thing for you.
So it depends on a few things. So one, it depends on your skin type or color, okay? The more aggressive lasers are so much better for fairer patients.
Okay.
So if you have and I'm not going to steal Crystal's thunder. We're going to let her talk about Fitzpatrick's a little bit. But as you get fairer, your skin can tolerate higher lasers or more ablative lasers or stronger lasers, depending on how you want to put it. So that certainly goes into it. Second thing is how much sun damage or aging process is in your skin, right? The older you get, the more you need it, sort of deal. So those are the options. And then the third thing is usually your tolerance for downtime. The higher the laser.
Be like, are we going back to the pain thing? Am I going to numb for this?
Well, we don't talk pain in here.
I know.
Look. We're going to try to make this process as painless as possible. But they are, the higher you get. So as you start going up, they all sting a little bit. Every laser is going to zap you. But yes, the higher you get, the more it can be damaging.
Invasive.
There you go.
Invasive.
So we were going to define the word ablative, and ablative is really invasive.
Yeah.
What that means is the wavelengths that are low, like IPLs, which are visible wavelengths, and our lasers that do laser hair removal, those are not ablative lasers, and so they're not invasive. That's awesome. That's a great. I didn't even think about that.
Yeah.
So, but ablative lasers are invasive, and to me, invasive means it's actually breaking through the skin.
Yeah, it's getting in there.
It's getting in there.
It's irritating that top layer while it does it.
And it's getting into the bottom layer.
The lower, all the activity goes on the lower layer. I think of invasive, ablative as also seeing something going on with the top as well.
It does
Okay,
both.
yeah.
Yeah.
So it's not just
So
like
your lower wavelength lasers are just touching your top.
Yep.
Which is great. They're improving it, right? But you've got to get into the bottoms for our problem patients, right? For the ones that really need it, and that's where the ablative
got to start
lasers.
thickening up that bottom layer, that healthy, that structure level.
Yep.
That's
And I love that word invasive. I know it sounds kind of horrible, but it really is. It's getting down to that second
Yeah.
layer.
Yeah. It's to smooth fine lines,
Yep.
okay.
help texture of the skin, sun damage. Everybody, every female that I know wants to stimulate collagen.
Yep.
This is where it's at.
This is where
Okay.
it's at. The two granddaddies here are Erbium Yags and the CO2s.
Okay.
And you're exactly right.
Okay. Which I mean, okay, so CO2.
That's his
versus-
wheelhouse.
that's what I was about to say.
Versus
That's
our
it.
estheticians will do the
CO2
Erbium
is
Yag.
going to be your thing. So
The esthetician world lives mostly in the lower numbers, which is your 800s, your 1200s, your 1000s, your 1500s, and those lasers are powerful.
yeah.
They do laser hair removals. They can do color and pigments of the skin. But when you start getting into tone and texture and resurfacing or getting rid of those deep sun damage spots, that's where you start getting into your ablative invasive lasers. Estheticians can certainly do Erbium Yags on some lighter settings. And then some of them even do CO2s on lighter settings. Some of our practitioners do them too. But when you start really cranking those devices up and getting very ablative, they're usually done by your surgeon or your doc. And they're usually like a CO2 laser, which is the granddaddy, is usually done during surgical procedures like faces.
Okay. So this is, I mean, you're asleep.
You're asleep.
You're asleep.
You're sedated. And
For an aggressive CO2.
For an
CO2.
aggressive CO2.
Yeah.
Okay.
Yeah.
But so like you say like Erbium and CO2 are kind of up there together. Are they are they comparable, would you say? Or do you think that this is two different?
So you will see on Dr. Google that they're comparable. I would say in my mind, they are not comparable.
Two
Because if you
completely
see
different
his
things.
CO2 versus an Erbium Yag, saying in our clinic, it is night and day difference. But it's because he is being very aggressive with the
Yes.
CO2.
With the CO2.
Doing multiple passes that yields a very significant result versus our estheticians who are doing this gradually over time,
Correct.
and having less downtime, but staying consistent and repeating the treatment.
All right.
Yeah, they can both be very aggressive
Right.
if
Yes.
you want them to be. They can both accomplish very, very similar things.
Okay.
But typically, the Erbium Yag is out there a little bit more and is used, like Taylor said, a little bit less aggressively and a little bit more in succession.
Okay.
Yeah, a lot less downtime compared to a CO2.
Yeah.
Yeah.
And we'll get into CO2, I'm sure, on
Yeah,
another,
we're gonna talk about it a little
on
bit,
another
too.
episode.
And
But
I think, getting back to the whole purpose of the conversation. So to me, like these, lasers or to me, you hit the ages of really 40 or above. And people always come in and they're like, I don't know what happened to me. I mean, I felt like 2 years ago, like it just falling apart. So,
I've fallen
and
apart
a lot
at
of it
30.
is, now look, we're raising a whole generation, in my opinion, like obsessed with their skin.
oh yeah.
Like I have a 14-year-old daughter who's like during COVID was doing peels at 9. I mean, it was crazy, I mean, these things, with her friends.
Yeah, but
online,
that generation is going to be ahead of times.
Absolutely.
I mean,
absolutely.
I think you're an older generation than you is behind times with
yeah.
skin.
Yes.
Absolutely.
The younger generation is ahead of times.
Right.
We're smack dab in the middle, and sometimes people think that a little bit of Botox can fix all their skin needs.
No.
A little bit of hormone can fix everything. I always say it's a marriage. You got to involve lasers, skincare,
And I
neuromodulators,
think that's
hormones.
mostly
Everything.
the older generation. And so I'd cut that generation. I think me and my wife, we're in the middle of our life. If you live to 100.
You better.
So middle of your life. And I think that, so our generation is, we had some bad habits when we were younger, like, getting sunburned and not wearing,
Tanning beds.
tanning beds and not wearing sunblock and, being judged how savage you get your tan, the cooler you were. I think the generation above us did that, but we kind of smartened up in our mid 30s, right? But a generation above us was tanning like crazy up until 50. And
I
there,
remember going to the tanning bed in high school.
it was still there. Yeah.
I lived in Hawaii. I would put baby oil on my face and just like biggest regret in
And you
life.
got
Like
pretty dark skin.
what were we doing? I remember I'm like, like homecoming's coming up. I have to go to the tanning bed this week. Like,
Right.
what are you
Terrible.
doing? Stop.
But
Like,
now, and it's all been replaced, but now they spray tan or fake or rubber.
absolutely.
on,
Spray
right?
tan all day.
So I think it's going to be a different generation. But
He definitely called a tan a rub on. Spray tan or a rub on.
There it is.
I don't
There
like
it
putting
is.
the spray. I don't like putting the self tanner on. Get yelled at. It's spotty.
Elizabeth.
It's not doesn't look right. So it's a very.
We do have an esthetician that is here, Crystal. She is going to come and share her knowledge.
Yes.
She uses this machine quite a bit.
Yep.
And want to talk about her experience and her expertise.
Yeah, and what it's like.
Yes.
What's the whole process? We're gonna get into it.
So we'd like to thank our sponsors, the Weiler Plastic Surgery Group, the largest plastic surgery group in South Louisiana, your aesthetic leader. We'd also like to thank Rejuvime Medical, your anti-aging, age-defying clinic, specializes in GLP-1s, hormone optimization or replacement. We also do aesthetics over there.
Yeah.
So stay tuned. We'll be right back, guys.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters. We all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
Welcome back to the consult before the cut. We have got Crystal with us. She is our expert esthetician,
Yes.
who is going to give us all the things about the Erbium laser. But
Welcome, Crystal.
Yes, welcome.
tell us a little bit about you, Chris.
Yes, I am. My name is Crystal. I have been with Weiler Plastic Surgery for a little over 7 years, and I've been an esthetician since 2014.
Wow.
Time flies.
Go, girl.
Yeah,
that's
I
it.
know, crazy.
And like I
So
said,
tell us, what's your favorite procedure? Why do you like to be an esthetician? Give us a little backstory.
Honestly, the biggest thing I like is just making people feel confident. Like, that makes me feel so good. I had a patient one time. Whenever she came in the building, she wouldn't even look at me in the eyes.
Really?
And after each time she would come, she would like start looking at me, and it just made me feel so good. Like, that is the
amazing.
biggest thing for
Yeah.
me.
that's awesome because you
Yeah.
deal with, you deal with the face.
Yeah.
Right.
That's,
Confidence.
it's
Yeah.
it's there.
Yeah.
It's out there.
And I
it's
I think you guys also develop these strong relationships
Yeah, we
with
do.
these patients, which is amazing.
do.
It's really awesome.
I say
That's our
therapists /
Yes,
all should have been
definitely.
social workers and
the amount of
Definitely
times
therapist.
that I've laid on Crystal's table and I'm just like, oh,
Vent.
Crystal.
Just go.
I'm like, can we just
let me
talk
tell you
for-
about my day.
I'm like, can we just talk for a second?
Plenty of secrets and tears in that room.
Yes,
Yeah.
absolutely.
So what's your favorite, what is your all-time favorite procedure or
Oh gosh, I
treatment,
love
if
so
you
many
will?
of them. I love to do dermaplane just because it's so immediate and it's so satisfying to get all the hair and dead skin off. I love chemical peels for the results. Lasers, I mean, they're really all my favorite. I love
And
all
probably
of them.
for different things.
Yes, for
right?
different things.
Yeah.
It depends on what the patient wants, like result wise. That's the
What you're
best.
trying to achieve,
Yeah, what I'm trying
what
to achieve.
downtime they have. Let's dive into the Erbium YAG.
Okay.
So give us your easy, what the heck is it? I know
Yeah.
you
What do
just
you-
talked
what do
all
you-
about it.
What makes you bring it up? What makes you
Okay.
recommend it? And what do you like and dislike about it?
Okay. So the results are phenomenal for texture, fine lines, wrinkles, sun damage. It definitely depends on the downtime that a patient wants. It's not nearly as bad as CO2, but there is some downtime with
Yep.
it. You do need a series of at least 3 treatments, and it's just an amazing laser. It's good for the top layer of skin and the bottom layer. That's my favorite about it. It's hitting 2 angles.
for the 3 treatments. How far apart do you have to do them?
Every 4 to 6 weeks is best to
Okay.
really get that collagen stimulated.
Ooh, there it is.
There it
There it
is.
is. The collagen. So about every 4 to 6 weeks, they come back, they do it again. Okay.
Yep. And then final results, collagen does take a while to stimulate. It's not an immediate result, of course. I always say skin journey is like working out. You can't work out one time and have a muscle. You have to do
Love that.
Yeah.
multiple treatments. I'm like your personal trainer. You can come work out with me, but you got to go home and take care of it. But because collagen takes about 90 days to fully stimulate, I do tell people 3 months after your last treatment, you're still going to get ongoing results.
What do,
Well, that's just fun.
what do you tell the patient that the laser is doing, and why do you say the patient walks in the door? What makes you say,
Yeah, who is
in your
your ideal
conversation, who is
patient?
your ideal, like, ding,
Candidate.
like, I see a patient, and I'm like, ding, like facelift CO2. We got to get
Yes.
this done. Like
Fat grafting.
Fat,
Yes.
fat grafting,
Yeah.
right? And so what makes your alarm go off? Well, I got to get this patient in that Erbium yak.
Texture and pigment is a big one.
Okay.
So the laser, it emits a light energy that it looks for the water in the skin basically, and it absorbs that. So the top layer, you do get some peeling, and then the bottom layer, you get that collagen and elastin stimulation. So someone who wants a little skin tightening too.
Yeah.
Good
I know that
candidates
is the
for it.
best. You can do a chemical peel and it
Yeah.
helps that top epidermal layer, but then you're not, getting a crazy amount of stimulation below.
Yep.
But this is doing 2 at once.
Yes.
And you probably have 5 days of downtime?
Yeah, 5 to 7. It depends on how aggressive we are.
Okay.
There is some pre-treatment.
Yeah, talk us.
What is
So
that?
yeah, talk us
I
through the
was like, wait,
process.
yeah. I'm like,
So
what's the-
pre-treatment, we have this amazing product. It's called Nectar from Elastin. It has healing properties in it, and it actually kind of cuts down your healing time in half. So I have them prep with it for about 2 weeks before.
2 weeks, okay.
And then use it afterwards, and that helps tremendously. It helps
is
cut
just
down
a
the
serum
redness.
that they're
yeah, it's
putting
just a
on?
serum. It feels really nice. It doesn't have really a smell or anything either, so patients love it.
Okay. And so they're prepping with the nectar before, and then walk us through the actual procedure. So a patient
day
walks in the
of.
door,
Day
day
of.
of. What are they doing?
So best come in with no makeup. We still do cleanse the skin. We have to topically numb for about 45 minutes to an hour. After I wipe the numbing off, I go in with the laser. The laser, because it's kind of vaporizing that top layer of skin, it does let out a plume. So we
What's
have
a plume?
to use.
What's
It's like that. You don't want to breathe in all that dead skin.
It's like a little puff of smoke.
Yeah, it's like,
like a
a
little
little.
poof
Yeah,
of
literally
air.
looks like a. Yeah.
Yes.
A little poof coming up.
It's basically like vaporized in the top layer,
Yeah.
right?
Right.
It's burning
So
it
you
off.
can see it, like the skin come off. So there's a little.
That sounds scary. It's really not scary.
It's not scary.
Oh, yeah.
It's not, and it really.
It's not. I can tell
No.
Brittany's like,
Yeah.
just
I can see it, but no one else can.
vaporizes into the air.
Yeah. And actually, it doesn't really hurt that bad either. I mean, people say it's a little bit warm. Now, afterwards, you do feel like you have a sunburn for a couple of hours. But during, everyone's fine.
Really?
okay, so
it-
go
Yeah.
back to the plume. So
Yeah.
with
Oh,
the
yes.
plume, we're
Go-
using
go
that
back to your
little.
skin.
It's a buffalo
just
filter. It's basically it's
yeah,
a,
it's
a suction.
It's like
a suction.
high-powered sucking the
Yeah.
air,
Little
sucking the
vacuum.
plume, vacuuming that the
Yes.
plume away.
So
nobody
it just
gets it.
just suctions all that away. The laser can do different settings. So it kind of depends on what we're treating, who we're treating,
Different
ages.
settings, as in different wavelengths, like we were talking, or is this just like
Like a lighter setting to where they don't peel as much, or they
Oh,
don't have
okay.
as much
Not as-
downtime,
it's
and then more
more-
aggressive.
Yeah. So remember, the wavelength is set.
the wavelength
Yeah.
is set?
You can't turn the wavelength. This is
turning
just
the volume up.
Yeah, turn the volume
Right.
up, dialing it up, dialing
Yeah,
the power.
make it a little
right?
bit more aggressive. If they have some contoured scars from like acne, we can hit those a little bit deeper, things like that, deeper wrinkles. So we can change.
How
that
long
up
does
and
that
make it-
process take? The actual laser.
The actual, well, by the time I take all the numbing off, all the prep, maybe 20 minutes.
Okay.
Oh,
Yeah,
okay.
it's
That's
not long.
Yeah.
And then you're applying nectar before they leave. What happens right after?
Right afterwards, they are going to feel pretty hot. So I'll put a Zimmer on them, which is a cold blower basically, and some gauze with some saline, and I just pat it on the face. It just feels really good. And then I do apply nectar before they leave. And then
How
they need
long
to
is
leave.
that
Okay.
sunscreen? Sunburn. Like how long does it burn?
It just hurts or feels like a sunburn for a couple of hours.
Okay.
Yeah.
Okay,
Afterwards,
so that
they're
tight red, that hot,
Yeah, that tight.
hot.
Yeah.
I
Yeah.
feel like when I get in my car
yes.
and it's like
Like,
That's
turn,
the
turn
feeling
the
of it.
AC
turn the
on.
AC
Yeah.
on,
Blow it
and
in
I
my
just want
face.
that's like that's all I want. Like after doing a treatment, I'm like, ooh,
And they do need to leave because I'm not putting sunscreen on because you have to wait 7 days to put sunscreen on. I like them to get like a big brimmed hat to leave the office with and some
Okay.
big sunglasses.
I thought it's like, please come to your appointment with a very large
Yes.
beach hat.
So no makeup, sunscreen, nothing for 7 days other than the nectar.
Yes. Well, we actually have a kit now. So we are giving them a cleanser, which is just a calming cleanser to use, the nectar for healing, and then the Soothe and Balm ointment. It's like a thicker balm just to help with the moisture because you do feel pretty dry afterwards.
But like we said, no sunscreen, no. So like
You have to be out of the sun completely.
and only those skincare products, not
For a
what you
week.
would typically use.
Yep.
Okay.
Yeah. Once your skin's healed, then you can go on your other products, but just be very gentle for the first week.
How do they look the next day? Are you presentable?
It depends.
All right.
I mean, I work here, so I would be presentable. I don't care what I look like
I
coming to
love
work.
to have
You know,
ladies peel
yes,
in
I
and-
want to be
All right, I
crazy
love that.
looking.
It's a good conversation.
Yes, exactly. But other patients.
You work at a bank?
Yeah, it depends on
Right? If you're
how
the
they
CEO
want to
of a
look.
bank, you may well.
Yeah.
I do have a lot of them come in on Fridays,
Right.
and then that way by Monday they look a little better. They're still
Okay.
kind of peeling by then,
Okay.
but right afterwards you are very red.
Very red, okay.
The day after there's some swelling involved, especially depends on how high we do the setting. Usually around the eyes they swell pretty good because I like to be more aggressive there because the fine lines are deeper. So they'll be swelling and red for the day after. So.
I feel like patients are embracing, though.
I think they
it's
are,
a
too.
conversation
I think
that they're
they
not
are.
ashamed of anymore. They have a
Yes.
laser for their skin
Yeah.
to look better, and it's a very easy
Yeah.
Yeah,
transition. I
not-
think it's better, right?
Yeah, I think so.
Okay, yeah.
I was at gymnastics on Monday, and a girl walked in that I know, just beat. You could
Yeah.
tell, like beat red on the neck, like neck up, and
Ooh, I love it.
She just walked in. I'm like, ooh. I was like, hey. I was like, Kim, what'd you do? And she was telling me. I was like, immediately. I'm just thinking,
Amazing.
like, great. I need to call and make an appointment. but it's just, I don't think people are kind of like ashamed of it
No,
anymore.
they're not. It's kind of
just
like Botox.
it's what I
Used to-
did.
no one used to talk about Botox, and now everybody does.
Right.
Everybody
Right.
gets it.
Everybody
It's
wants
fine.
to.
Yeah.
Everybody wants to be getting stuff.
Yeah,
Everybody
absolutely.
wants to be getting
Yeah.
things.
I love it.
So, okay, once you do your 3 sessions, how often beyond that? Would you do this yearly?
Yes, I would do it yearly because we can't stop aging. We still age, so maintenance is key. Wintertime is a great time to do it if you know that you're going to be out in the sun in the summer. We live in Louisiana. People are not going to stop getting on their boats and being outside all the time, yard work. So I do suggest doing it in the winter if they know they're going to be out in the sun in the summertime.
I am in the
starting
middle
that-
of
Starting it.
starting baseball season, but I'm like, I cannot do this right now. But when would be? I have an event in September, so I want to get 3 sessions in before
Yes. Yeah.
then. Okay,
So,
but
yeah.
it's
Just
90
invest
days.
in a lovely hat.
Big hat.
Just
Yes.
big hat.
Hello.
Just big hat. Maybe a
Tons of
mask to wear to the
protection,
ballpark.
yeah.
Yeah,
Right. Better.
I'm good with that. What in addition would you say? So they're coming in for this laser. What are they doing with this?
Skincare, 100%. And that's with anything. I do tell people I'm kind of like your personal trainer. Again, you can come work out with me, but you have to go home and keep dieting and exercising. It's the same thing when it comes to skincare. You have to keep going, keep up, and that's going to help with the laser results. It's going to help maintain. Because if you stop, your skin is your skin. You're born how you're born. The DNA is there. Everything's going to revert back if you completely stop taking care of yourself. It's just like dieting.
On the post, I know we had talked, I don't remember now, I don't remember what treatment it was, but it was like, okay, like you come back in X amount to do like a dermaplane just because like you have a lot of stuff.
Yeah.
Would that also be sort of like a recommended treatment after
You can,
this?
just to kind of get like the rest of the sloughing off. I would wait probably maybe 10 to 14 days for that just to stay safe, make sure you're not peeling or anything after. And then I can get the remaining off and then you leave with a good glow.
So like basically 2-week follow-up, come in, get it
Come
nice
get it
and shiny.
yep. And then 2 weeks later, come back for your laser again.
I love the
Is
way that feels.
everybody a candidate?
Most people, lighter skin types are better for it. If they are darker for maybe a light 5, I would pre-treat first.
What does
with-
that
What's
mean?
a light 5? Let's just start there. What's a light 5?
on the Fitzpatrick scale. So I am very pale, but I still kind of tan a little bit.
We're
so
going to
I'm
go
a
back.
2.
What's the Fitzpatrick scale?
Explain to us what that is.
Okay, so it's
Just basically.
so a different skin color, basically.
Okay.
Yeah.
And it's rated 1 through
Yeah.
6.
1 through 6, yeah. But the the darker skin types, I do want to pre-treat with like a pigment suppressor, a hydroquinone, so that just helps them not be as much of a risk afterwards, because darker skin type does have has more of a risk of burning, scarring, things like that when it comes to lasers. So pre-treating is very important.
Basically, if you're translucent, you're a 0.
Yes.
Right? Well, 0 1, and then the darker your skin goes all the way up to 6.
Yes.
Right?
Okay.
And so you start getting into those 3s and 4s, and that's where it gets a little iffy.
Yeah.
Right? You don't want to hyperpigment or cause more pigmentation on a patient, and also patients that have darker skin are a little bit more prone to scarring issues, right? And so long-term scarring issues, we all scar.
Yeah.
And so you don't want to cause, because this is an ablative laser, which means it's invasive.
It's that invasive. This is the invasive.
So you got to be
laser.
careful with that.
Yeah.
But there's certainly settings and things you can do. And like she said, so it just really depends.
Is melasma a contraindication because we're talking about pigment?
So normally I would say yes for different lasers because the heat is so strong. With this, I can do a lighter setting and it's okay. I would still probably pre-treat them with some hydroquinone, a pigment suppressor, just to stay safe. But we can definitely treat them just a lighter setting.
Okay. Can you combine it with anything the same day?
I
Like
believe you can
Botox
go.
and stuff and fillers or what?
Or
You
different?
mean treatments like RF microneedling?
Yes,
we
like-
can do that.
Correct.
Yeah.
So
Hit
you
your
could
skin
do that.
twice,
Yeah.
basically, right?
Yeah.
That's the big
that would be a
mamma-jamma.
big.
But
The
big results
excitement
too.
that
Yeah,
just
it would be
happened.
amazing.
You could do Botox right after, no problem.
Right, because you're just topically numbing.
Yeah, dermal filler.
Mm-hmm.
I'd probably wait just because
Right.
the skin's compromised. That top epidermal layer is a little compromised. So I'd
Right.
probably wait on that. But
Mm-hmm.
yeah, you could do Botox the same day for sure.
Because they're just red after.
Let me ask you
Because
this:
the
how
swelling has
often do you think patients should do something like this?
So session 3 every 4 to 6 weeks, and then I would do a session 3 yearly, just to
Yearly.
maintain.
Oh,
Oh,
awesome.
okay. So like, get your winter quarter.
Yes.
Your winter quarter
Yeah.
is your face quarter.
I think one of the things that people don't realize is when you see those ladies and even those men with that amazing skin, the consistency that
It's
goes
what's
into
key.
it, right?
Yep.
All right, I have this patient, she's a friend of ours, and she always gets compliments on her skin, even though she was previously a little bit of a smoker. And she is religious about every 3 months getting, like a light-based energy
Yep.
device, whether it's, IPL, or there's a ton of lasers, different things out there, and her skin glows, right? But it's consistency,
It's
don't you think?
consistency with skincare combined and Botox and filler. I mean, all of it, like Taylor
Right.
said earlier, it's a marriage.
Right. And I think the other thing for patients to realize, you can have a pretty good difference with these lasers, right? The more aggressive laser, the more dramatic. But even with that, they're not one and done, right?
Never.
You do have to keep this up, right? You're, like you said, you get that body working out, right? And you got a perfect body. You just can't go to McDonald's after that and every day and let it go to.
Exactly.
I know that's
go.
such a great way to explain it too.
Or
Like-
king cake. We're in the middle of king
Hey
cake
now.
season. Like get it out.
So
of the
good.
Cheat a little bit.
No, Taylor, don't stop. More king cake, please.
I love king cake.
No, I mean, this sounds like absolutely amazing. Like you said, it's almost everyone is.
You'd probably love it.
Oh my god, I'm
I
already
know.
thinking. I'm like,
She's
'cause
like, I'm ready to
Crystal
come
and
in.
I-
I'm going to Mexico this week.
Yeah, right.
As soon as I get back from vacation, for sure. But and Crystal and I have been on quite a skin journey because I have terrible eczema, and so it's like every time we get into something, we're like, ooh, let's see how this
And your
works.
skin looks,
Yeah.
y'all doing a great
You
job.
look amazing,
You're
both of your
Both y'all.
skin. Yeah, truly.
Yeah. Fair skin can be difficult. Right?
Yeah.
I mean,
Yeah.
dark skin can be difficult. Fair skin, it's that middle skin.
Yeah.
Perfect skin over
Yeah.
here. That sort
I
of
don't know about
perfect.
that. I'm signing up for that.
You got a nice
it's,
skin.
it's all of that Hawaiian baby oil.
Yeah.
It's like,
That's the
just gorgeous.
So, what would you say to a patient, new person listening about the Erbium YAG?
So definitely come in for a consultation. Make sure you're a good candidate, of course. And then we can kind of go in more into detail, see if you're ready for the downtime, see what you're committed to too, as far as skincare and coming to see me consistently and all that. So consultation is number one.
all right.
love that. And go ahead. Once again, I say it every time. I'm like, it is a road trip. Make
Yes,
sure
it's
that
a
you've got a
journey.
great road trip buddy
Yep.
with
Yeah.
you. It is a
you go.
journey.
Yep.
So yeah, well,
Thank you, Crystal.
so
Yes,
much.
of course.
Thank you so much for joining us today and sharing all of your knowledge. And yes, there's a solid chance that we'll absolutely be coming to see you for this Erbium laser.
More than a chance, I'm sure.
But thank everyone for tuning in today. Be sure to follow us on Instagram and TikTok. It is at
Subscribe.
The Consult Podcast for updates and all that jazz. Yes, subscribe to our YouTube channel. And then I think now it's like Apple, Spotify. We're on all the things.
All the things.
All the things.
Basically
now.
famous.
Yep.
So basically famous, yes. So make sure everyone always stay curious and informed, and make sure you always consult before you cut. We'll
Absolutely.
see y'all next time.
Thanks, guys.
Thanks.